welcome to another segment of the Rehab Corner on Just Our Two Cents. Ian, what are we chatting about today?
Well, Wade, today we're talking everything ACL, particularly what happens during the rehab, how come some rehab fails, and common pitfalls that clients seem to fall into when they are going through the rehab process.
Okay, so someone has a ACL rupture, they get the reconstruction done, they pitch up to your door, first session, what's your management?
Well, first up, the big thing I want to get across to them that this is a long-term process. Despite what your surgeon might have told you, you're certainly not going to be running within 3 months if that is what you want to do. But also, very importantly for the client to understand that we're not going to evaluate things based on a timeline. You know, we're going to look at rather certain goals, and your ability to progress through the rehab is going to be dependent on whether you meet those goals or criteria, if you will. And that's always been my approach, and I think if the person can understand that then they're less likely to compare themselves to other people. You know, and they're looking at how can I better myself, what are the targets that I've set for myself, and how can I meet those targets, and how can I exceed those targets.
Yeah, I totally agree. I'm more for the criteria-based as well rather than time-based. A couple of things, you know, you can have ACL surgery on the same person, same technique, and you should expect different results, you know. So definitely criteria-based, and also kind of measuring yourself to other people, especially what we do is, you know, the well-known sports guys, you know, that's what we measure us. You know, this guy came back at 6 months, you know, he was back on the field and that. Although even studies show that 6 months is, you know, what's the estimate of 6 to 7 times a re-tear rate if you're returning before 9 months. So, you know, that's also not the smartest thing. But then
just,
again,
one second, just explain that a little bit more, maybe.
Okay, so what they're saying is basically you want a minimum of 9 months before you return to sport. You know, it might not be at 9 months because that would be time based. It can go up until 12 months before you are cleared by your physiotherapist or your rehab team to return to sport. And they're saying returning before that minimal kind of 9 months period, you are 7 times more likely to re-tear your ACL or tear the contralateral side ACL.
Than somebody who goes through...
Than someone that goes through the entire process, ticks all the boxes, ticks all the criteria, and then returning to sport.
Yeah, and so, that's kind of what we do see often, actually.
Exactly.
In terms of why rehab fails. A little anecdote I want to throw at you is what I sometimes use, an analogy I use to explain the process to a client is that I say to them that you've got to look at it as like you've been in a car crash, you know. So it's a major car crash. So when you get back from that, we can't just get you into the car and put you on the highway, you know. We've got to put you in the car, get you familiar with the car, get you comfortable with actually just sitting behind the wheel of a car and not having any anxiety about driving. Then you'll start the car up, you'll slowly start to rev it, maybe pull it out the driveway a little bit.
Drive it around the block a little bit.
Or in an empty parking lot. And then once you can get comfortable with all of that, then we'll put you on the highway. And then we'll start, you know, start throwing quick turns at you and getting you to do donuts, so to speak, with the body. And I think once I can start to understand that, they realize that, you know, I have to put in the effort also here if I'm going to get to that stage. You know?
Exactly, and that's a big part of it. It's the compliancy from the patient. You know, what we do here, you know, like 45 to an hour with the patient, let's say once a week, if it is that. That's nothing compared to the rest of the 6 days that the patient has or 5 days that the patient has in the week to actually put in the work, and that's a big part of it. I always say you gotta put in that work, especially with ACLs. You know, we just here to guide the process and kind of evaluate and monitor, but the athlete or the patient has to go home. They have to put in that work.
Yeah, and I mean that's probably one of the biggest factors in terms of failed rehab. And we're going to be talking a lot about, or I'm going to be referencing quite a bit about this paper that was published. I can't remember the date, but we'll probably put it up in the links on the video later on. But I mean, they talk a lot about why rehab fails, and compliance is probably one of the biggest factors. You know, people not willing to put in the work, or not necessarily understanding that, you know, the biggest gains, like you said, are going to happen not in that hour session when you're at the physio, but in that 24 hours when you're not here, you know, when you're living your daily life. That's where the gains are going to be made. You know?
Yeah, that plays a big part. Like, I think, what's the rate? Like 80% a non-compliancy rate for exercise therapy or rehabilitation at home. And that's a big, you know, that means there's a 20% of these patients that are going to be successful in rehab or not kind of perform at their best, you know, without kind of being worried about a re-injury. You know, re-injuries, there's always that threat of it, but, you know, better prepared always kind of gives us better outcomes, you know. And that's, I think that compliance is such a big thing, especially with ACL rehabilitation.
And like, I want to get your take on this. Is like, how can we get people to buy into it a little bit more? What strategies do you use?
Kind of like, you know, I always start with goal setting, you know, like instead of us as therapists saying, okay, I need to tick these criteria for you, you need to be here before I move you on to here, you know, I kind of, before we kind of go kind of micro, you know, I want to know, okay, what do you want to do? Where do you want to get back to? You know, I need to get back onto the soccer pitch, you know, or I need to be able to run, you know, comrades again, you know. So I'm like, okay, so, you know, this is a realistic goal. We can achieve this together. But I'm going to need you to help me help you, you know. We're going to need to put in the work, you know, in order for you to be able to, for example, soccer, be able to kind of cut on that pitch and move and jump, header, kind of land and then change direction. We need to make sure that you can first kind of control the stability of the knee, you know, and kind of control the pelvis in cutting actions. And, you know, so now you're making it more kind of realistic goals, you know, instead of we're going to take you from session one and get you straight back on the pitch. Sometimes that jump is just too far. So we're setting mini goals, like, you know, like step one, let's first get the range of movement back on this knee, you know. Step two, let's start to activate the squat again, you know. So we're setting small little goals so that the athlete or the patient doesn't get lost in this big thing, like how am I going to go from here back to the soccer pitch, and it kind of, they lose that motivation when the leap seems too far. So we're setting smaller little goals and we're achieving that, and making them understand that this is criteria based, you know. You can kind of challenge them, especially if they're very competitive athletes and things like that, and you can say, we are hoping for in the next 2 weeks that we get to this point, you know. And it gives them a little bit like an internal competition, because, you know, now they're like, okay, I really have to do my things because we are hoping to get to this stage in 2 weeks, you know. Making them understand that this is criteria based. If this 2 weeks come and we're not there yet, we're going to still work, we're not going to progress, you know. So kind of getting that teamwork going, setting those goals are, for me, is so important.
And getting them to understand also, like you were saying there, that, you know, that whether you're going to be progressing to that stage is based on a whole host of factors that are sometimes not under your control necessarily. I mean, like, we're looking at, you know, how the tissues heal or progress, and that's based on a whole bunch of other factors as well. Genetics, you know, your age, your activity levels beforehand, you know, how all these other social factors also impact on you, you know, whether you've got a highly stressful job or life at the same time, you know, all those factors impact on how quickly or how slowly the healing develops, you know, and that's also something that we probably need to incorporate a little bit more, so, you know, like getting the patient to understand that aspect as well, you know.
All right. 2 things I'd like to touch on, just as you were saying those things, are testing to return to sport. So once that time comes and, you know, you feel that they might be ready, 9 months minimum period comes, can we get them back on the pitch? What's your approach to that? And is it your job to clear the patient to return to sport, or is it the surgeon that did the surgery's job to clear to sport? So those kind of in your call. What's your approach?
Starting with the first one, from the start also I like to reference what's kind of popular at the moment now is this whole control chaos continuum theories that people have put forth, and I like to use that because it kind of explains to the client also like how the progression goes. And a lot of the time people will say to me, I ran on the treadmill, you know, does that mean I'm ready to go play rugby, you know, or to go play football, whatever? And the big difference is getting them to understand that we're moving from sort of a situation where there's high control, like in the clinic or in the gym, where you can control the surface, you can control the load, you can control a majority of the things. So everything is happening at a speed and at a rate that you can control, you know. And whereas when you're playing on the rugby field, you don't know what the grass is going to look like, you don't know if your boot is going to get stuck, you don't know at which angle this guy is coming at to hit you, this 200 kilogram monster that's going to try and take your head off. And those things are things that you can't necessarily replicate in clinic, but we try and move towards a closer version of that. And that's my sense on how things sometimes fall apart for clients that go from being strong in the gym, then all of a sudden making that big leap. And our kind of role is to try and get to as close to mimicking that activity that I want to do in a controlled environment first, and then gradually introducing the chaos, and then sometimes having to peg that back. So sometimes you push the client and it's gone a little bit too far, you know, being able to recognize that and then say, okay, we've pushed you a little bit too far, let's get you back on track a little bit, let's either take the load away or introduce a little bit less chaos in the environment, like less challenges with your proprioception, your balance, and your strength, and change of direction activities at the same time.
Yeah, I think just going on the whole rugby thing, I think a cool thing that I like doing is getting a ball in hand, you know, instead of just making them bound or one leg hop, get them through with the ball in the hand, get them to offload their ball, get a Swiss ball and bump them with it, you know, and then get him, you know, so it's never going to be able to completely replicate game day situation or, you know, but where they can build confidence in, you know, I've taken a bit of contact, I've landed, I've had a ball in my hand, that definitely gives them that confidence.
Yeah, and introducing that unknowns or the chaos of the sporting environment at the level that you can kind of control a little bit, man. You know, like you were saying, getting them to walk around with a ball first in the hands, and then all of a sudden you're introducing a little bit of difficulties or challenges for them, like bumping them a little bit, or getting them to pass while walking fast, or passing off a leg that they're not used to, you know, and introducing those rotational or acceleration, deceleration challenges into a functional task, you know. But once again, matching that to where the client is at the time, you know, and being able to objectively rate that and then progress it at the same time. You know? I've forgotten what you said.
Yeah, I thought you were avoiding that question. So who's in charge of return to sport? Who gives you that decision? The surgeon or your physio?
So my take on that is that in terms of physically what the person is able to do, I think the physios together with the strength and conditioning coaches would probably be the best to say that physically this person's able to do that. But I think it needs a collaborative approach when it comes back to returning to sport. So the coaches will definitely have to give a lot of input in terms of saying these are the type of tasks, this is the level that they need to be able to perform at. We might be able to say that they have the capacity to do that, but the coach will be sort of intimately aware of what their psychological state is, what their ability to actually do the particular task under high pressure situations, you know. And this is where we need to collaborate more. I think instead of sort of trying to take ownership, you know, working as a team is probably the best in terms of returning somebody to sport, and being able to say, I'm not scared to say that, look, when it comes to this particular sport, I don't know anything. I can tell you how your body is supposed to function and whether you're at that level, but when it comes to your sport, I would suggest we have a conversation with your coach and let's see how we can gradually get you into those tasks and introduce those high pressure situations. So I definitely believe it's a collaborative approach.
Yeah, I think a team-based approach is the stronger approach. I do also feel like, you know, like we were stating, like who gets the go ahead, you know, it has to be a collective decision. Obviously the guys that are spending more time with you, I would say, would have a stronger case for making that decision, you know, rather than once in a while follow-ups. But the guys that are actually going through this journey with you probably has a stronger case in making those decisions. And I think a huge thing that you mentioned was the psychological stresses of the sport. You know, the athlete might be physically prepared, but where are they mentally? You know, am I going to go back out there and re-injure myself? Or you know, so that plays a big part of it. In returning to sport, you know, and not only in the physical aspect, but the performance based, you know, they're holding back. They can't be where they were before, or better than they were before if they have that little kind of inhibitor.
Yeah,
you know?
yeah. And like, I mean, so now that you've thrown me a few curveballs, let me throw one at you.
Yeah.
How do we fit all of that into the pressure of a professional sport, where a guy's livelihood is determined or dependent on how quickly he gets back, for instance?
Yeah. So for me, it's just being very honest with the person. You know, it also depends on the player's contract, or where they role in the team. You know, is he a star player, or is he just, you know, a reserve player that they're gonna, let's be honest, where the team's gonna kind of put more finances into that player, getting that player back. For me, it's like my job is to get you back as soon as possible, but as safely as possible. You know, it's at the end of the day, I'm gonna make the decision. Listen, if I put you out there, you're just gonna, chances are you're back with me in a couple of weeks. You know, especially at that elite level, and the demands of that elite level. Or you go back, you're fine, but you can't perform the way you used to perform. You're still not going to cut it. You know, you might get cut from the team or get cut from the starting lineup once you're there. So for me, it's like, you know, just play open cards with the players. Say, listen, this is the time that we spend. We're going to work. This is our goals. You know we want to get you back there. It's like, you know, it's such a touchy situation, because we know that they need to play to make, you know, to feed their families. And for their livelihood. So it's such a difficult decision. My best way of explaining is, let's make this, for example, regarding ACL, let's make this the solid 9-12 month period, so that we make sure that you don't suffer longer than this, you know. So you don't go back, you re-injure yourself, and you're out for another couple of months, you know. So let's make this the rehab period, and get you stronger than what you were before the injury, and let's keep you on that field. So that would be my approach.
Yeah, I mean, I often say to people, to clients, with this kind of a problem, is that, and it might seem a little bit cold, but, you know, for me, that's not really part of my decision-making process. You know, like, my job here is to get you back to an optimal state, you know, and I can't give you time frames on that necessarily. We've discussed the whole criteria-based thing, but my decision-making isn't going to be influenced on, you know, you need to get back in 2 months in order to start making money. Those kind of major life decisions, I'm going to leave up to you and the people that you trust in that way. And I'm going to try and help you as much as I can if you become time pressured. But ultimately, all of my decisions are based on your health, and not just, I like what you said earlier on, is not just about getting that ACL or that knee back to where it was before, it's getting it even better than it was before, you know, and then making sure that you stay on the field, not for this next season, but the 10 seasons ahead, if you can, you know.
Yeah. So I mean, yeah, that's ACLs, or that's our views on ACLs. Let us know what you guys think, and add any comments if you disagree with us.
Yeah, also, if you want any advice in terms of ACLs, and if you have any questions about the rehab, please hook us up on the social media. We're happy to answer any questions that you might have.
Okay, shot guys.